Hello and welcome to Conversations with Gagan Mathur, where I talk about people, decisions, and outcomes. So, viewers, when it comes to health, the most dangerous risks are not the ones that we respond to, but they are the ones where that we fail to recognize early. In India, heart disease is increasingly striking the most productive years of life, and this is not as a sudden shock, but as an outcome of failed to recognize signals or risk normalized and delayed prevention. It does not only affect the individual patients, it also affects their families, the organizations, and continued leadership. Additionally, it also impacts long term economic resilience. And yet, largely our response remains limited as a reactive response. Instead of, and this reactive response rather is doing treatment after the adversity strikes or when the illness comes to us, instead of having a foresight about when before the damage is done. And this will be the topic of my today's conversation. I am joined by Dr. Kamales Saha, who is a recognized cardiac surgeon and is renowned for performing arterial CABG surgeries using Lima-Rima techniques. He is also awarded with 3 gold medals and 5 silver medals, and also numerous other awards. Additionally, to his credit, we have 35 publications, 20 conference presentations, all around centered around CABG surgeries. Dr. Saha is also a preventive cardiac specialist, and there are numerous individuals under his preventive care. He is an IICA certified independent director as well. And beyond his clinical work, Dr. Saha also brings a rare systems level perspective, a perspective that connects governance, health, and long term sustainability. And it also reframes prevention as a strategical priority, not as a clinical priority. And if that is not enough, he also has a list of hobbies. I cannot take the list of the entire hobbies right now, but he likes to do meditation. I'm just taking the important ones, right? And he likes to do spiritual healing. He also is doing Vedic medical astrology. So I think there are tons of them. Glad to have Dr. Saha you here. Welcome to the podcast.
Thank you, Gagan, for such an extensive introduction. And this is actually very, very important topic today.
Yes,
It's very overlooked in India, everywhere, in the general public, government level, and board level also.
I agree. I agree. So I'll like to start with your journey, right? Before we jump into the core topic exactly. So you have spent almost 3 decades in this field doing cardiac surgery, and then in the most acuity environments where treatment is saving lives. What I'm curious to understand from you as a as an outcome of your journey, yet at what point of life, of what point on your journey, you realize that treatment alone is not sufficient and prevention has to come as a more strategic priority, not the medical one.
No, this change of perception has happened during COVID-19 pandemic.
Okay.
So all the elective surgeries was stopped because of the COVID-19 and operating rooms were silent.
Mm-hmm.
During the lockdown period, I started receiving calls from relatives, known to persons, patients' relatives, having typical symptom, heart problem, chest
Mm-hmm.
heaviness, exertional symptom, acidity, not responding to normal medication. And even ECG was not possible to do because nobody was going out of house and they were scared to go to the hospital because hospital there is a real chance of getting COVID because only COVID patients are going to the hospital.
Right, right.
So this is an unprecedented situation. I've never seen this in my career. So what to do? Then we started them on medications as if they're having a heart problem.
Okay.
And this includes two of my relatives also over the phone. And they
Mm-hmm.
started the medication. And after the lockdown was dissolved, and they were investigated, my worst fear came true. Most of them, more than 90% of them, have got coronary artery disease, and which if you have not given the medications that time, probably they would have had a heart attack. So this changed my perception because, long time, 30 years back, when I was getting trained in general surgery, my senior, who was a just completed MS 2 years before me, actually died of heart attack when I joined the MS. So just after completing. So it was a very unfortunate thing. Then I was putting one plus one together, if these medications could be started on on the symptoms itself, then
Yes.
many deaths could have been avoided because even I treat surgery after the heart attack, but many of the patients after heart attack don't reach to that level. So why let this thing happen? So that's actually changed my perception about prevention. And when coming to my career, I thought I should take up prevention, but at an individual level, it is very difficult to make a big impact because I can treat only a certain number of patients. But if you incorporate this prevention of heart disease as a part of board policy, then your impact will be far-reaching, and it should be a part of the national policy also. And you can see that recently our PM was on the TV asking people to use less oil because obesity has become a serious problem.
Correct. Yeah.
So and that's how I took up this uh, independent director qualification to make an impact at a board level.
I really appreciate that, you are putting so much of initiatives and, understanding the problem, looking into future, how things can be managed, and from experience, you are doing so much. I do not, though, want to jump into this, but I really have one question that just came up to my mind, and I just ask it generally because I do not want to make it, another controversial question. Simply, there are a lot of questions in general public's mind that this increase in heart disease is having because of many vaccinations that we were doing. Is it true or from experience, or it's not a truth thing?
No, no, actually, recently I wrote a post also the effect of vaccine on
Okay.
heart disease. Recently, there are multiple studies and which actually has shown that COVID vaccination, if anything, has reduced the number of heart attacks.
Okay.
And actually, why when it is affected by virus, unvaccinated people, they are more prone to heart attack. So at least we can say that COVID vaccine has not increased the heart attack. It is probably, the lifestyle that has affected.
Okay.
One of my senior colleagues I'll share with you during COVID, he was doing 2 hours of exercise. And on Sundays, he started walking to the hospital just to do the exercise or almost about 10 to 15 kilometers. But I think
Wow.
everybody else, majority of the people I know, were just cooking and eating, not doing
Yes.
any exercise.
I myself picked up a lot of new recipes looking at YouTube and cooking at home.
Yes.
So I mean, though we are laughing, but I think that time it was really a very serious thing because it was like an unknown enemy. So I'll not dwell into much into because that's a separate topic to talk about. Let's move further. So this question is always puzzling me actually. And when I was thinking about this, our discussion, our talk, I was thinking that I'll definitely ask this question to you. So, you know, we in India, we really have world-class cardiac system here, right? Where we take care of patients having cardiac issues and all. But what we are still seeing is a continuation in increase of premature heart diseases and all. And so let's talk about from your experience and your vision or your from your perspective. Uh, why does the treatment first healthcare model basically fail to protect people, especially in Indian context?
See, the treatment-centric healthcare, what we are advocating, is not very good option, because premature heart disease keep rising. You can do a bypass surgery beautifully to restore the blood flow or even put a stent,
Yeah.
but it does not actually stop the basic problem that why the block is being formed. And
Yes.
also, when somebody gets a heart attack, even in United States, some people will not even reach the hospital in spite of having such ambulance service and healthcare. In India, you can imagine, I'm in the city of Mumbai, where you have to take an ambulance. Ambulance will arrive maybe half an hour later and to reach the hospital. So this is the acute period where a lot of people we lose, and particularly the young population.
Yes.
So, the treatment has got its own limitations. Plus, it is expensive because even if you pay, even the insurance pays for the hospital stay, afterwards they have to be on lifelong medication. And if a damage is done to the heart, then that part may or may not recover. So somebody who is having a normal heart function, as say suppose heart function drops certain level
Mm.
after heart attack, this may not be possible to make it recover to a normal level even with the restoring the blood supply. So prevention is the solution, because
Okay.
if we prevent the heart attack, then this will not happen.
Yeah. So I'll move to the next important thing related to heart diseases. Uh, in nowadays, a lot of people have a trend of getting preventive healthcare tests done in various labs and pathology labs. In fact, we have big hospitals providing some packages as well. Amongst all those things, as a common man, the people recognize only one parameter related to the heart disease, cholesterol. That's most talked about metric, right? It's most visible metric. And when we talk about prevention of heart disease, we always talk about cholesterol. Now, what is puzzling here is that many a times this cholesterol number might look acceptable to people like us, uh, and then still it is not. I mean, the Indians or our Indian population is not protected still. Moreover, and from this perspective, I just want to understand from you that why do these numbers that look acceptable or okay, fine, they are failing to protect individuals? What could be the cause behind it?
The cholesterol in the blood is actually an essential molecule. It is measured in different fractions. There is one is called HDL cholesterol, which is protective cholesterol, and higher number is the better. While there is another called LDL cholesterol, which is bad, and higher LDL cholesterol is actually associated with atherosclerosis. So cholesterol, we cannot say that cholesterol high means patient will have a blockage in the artery. It is not like that. It is. It happens when the cholesterol particles which are circulating in the blood numbers are high. The arteries will pick it up and store there, try to reduce it, and this leads to arterial wall blockage and inflammation.
Yes.
Then, when the plaque ruptures, then the heart attack happens. So, cholesterol should be viewed as more of a sign like a smoke, but it is not the fire.
Okay.
Normal cholesterol level in India or in whole Southeast Asia, actually, there is a small particle called lipoprotein A or LPA, which is actually genetically determined, and its prevalence in Southeast Asia is quite high. So when this LPA is high, even person who are lean and thin, does not have obesity, does not eat non-veg or alcohol or anything, but I have persons whom I have operated at the age of 30,
Yes.
was marathon runner. But
Oh,
these persons, if we check LPA beforehand, before the heart attack has happened, then probably it would have been prevented. The another word of caution about the preventive health checks, we very commonly do stress test on a treadmill. It is very commonly done, and people will
yeah.
say that my treadmill is normal. But treadmill will make you exercise only for 10 to 15 minutes. So if you are regularly doing exercise for 1 hour or 2 hours in the gym, your treadmill is going to be normal, irrespective of whatever be the mm, coronary artery status. Like if you are regularly exercising for 2 hours and in 10 minutes, stress test is not going to pick up your problem because body is used to exercise for 2 hours. So 10 minutes, it will not show any sign in the stress test.
Yeah, so I think, Dr. I must say that you are not only a cardiac surgeon, you are mind reader also, because that was my next question. I was thinking about lipoprotein A, because I think few weeks back I have got my, this pathology test done, and I was looking at the report. So there were multiple parameters, and out of curiosity, I noticed that something written as LPA-A, LPA-B, and all. So I thought I'll ask you this question when we speak, and I knew that we are going to speak today. So lipoprotein A, basically, as we know, is it's largely invisible, genetically determined, some a parameter basically. And what do you think that in it is why it is important in the Indian context basically? And what is the impact of this, and how does it impacting the long term productivity and all in Indians?
The lipoprotein A is genetically determined. A lot of people I see, they come with multiple reports done every year. Every year they're getting a lipoprotein A done. So there is no point doing it every year. Once it is high, it will remain high for the lifetime. So if you check it once, that is fine. And the other problem is this level will not come down with the normally available medications, the tablet what we use, because it is not affected by the normal medication called statin. There is a newer medication which will come later, can reduce LPA, but once you have a high LPA, it is fixed for the life, and those persons should be screened very carefully, and putting on prophylactic therapy to prevent heart attack.
I'm sorry, and more frequently, probably because they have a high tendency of getting heart attack. Is that what you are saying? So I
No,
just noticed.
no,
Yeah.
those patients, let me correct. They should be actually put on prophylactic medication and
Okay.
cholesterol profile checked every 3 months, so that
Okay.
the LDL level, which is acceptable to a normal person, may not be acceptable to them. We want a
Okay.
lower level so that they don't develop heart disease.
Yeah, very good. So I just heard a word called a statin that you use, and I just want to talk about that. So there's a very growing hesitation about statin, and a lot of people having a curiosity around these advanced therapies, like being known as PCSK9 inhibitors and all. So what do you think that, what will be the impact of this, and how should it be treated as a long-term risk governance by the clinicians and the leaders from the corporates? What do you think about that?
Statin is the most routinized drug of modern medicine. And actually, there are a lot of videos circulating in the social media describing statin as the causative of all problems and things like that. See, we have to take a rational view. The statin is actually life-saving drugs when used appropriately. It is most extensively studied, and if any medicine has made an impact in heart disease prevention, this is probably the medication. But we see often it is started too late or stopped very early, or it is underdosed, so that the desired effect is not attained. We have to remember one important factor: the statin will increase somebody's blood sugar. So if somebody is having borderline diabetes, they will become more diabetic range because of using the statin. But statin does its work in stabilizing plaque, and in persons with coronary artery blockage, they can actually prevent the heart attack. So it should be used judiciously by a proper clinician, not as a just a online uh, therapy.
Yeah, so that's a really good point. And what I am understanding is that prevention is not only about choosing between lifestyle or between medication, right? It's all about early detection, intelligent interpretation, and then disciplinary action long before the crisis strikes us, right? That is what you're trying to say.
See, you said lifestyle. That is actually, I'm going to come next. The lifestyle is non-negotiable. You cannot take statin and replace it for lifestyle modification. So regular diet, exercise, stress management has to be there. And then it comes that there is a new medication which is called PCSK9 inhibitor. This medicine is now available in India for last a couple of years, and it actually acts at a genetic level, so that liver will be able to remove all the bad cholesterol from the blood, and it actually works in reducing LPA also in the persons who are LPA positive.
Yeah.
This point of time, that is quite expensive, so uh, we don't advise it to everybody, but somebody who can afford it wants to take it, welcome to take it.
Okay.
The current form of therapy, it involves 2 injections in a year, but there is a oral version which is on the pipeline, which is expected to come maybe this year, mid this year. We're expecting that. And if this medicine is available, probably this will make a big impact in the incidence of heart disease, particularly in the country of India.
Okay. This really, a very good point that I put across, that all these medicines and therapies that you are talking about, that do not replace or they are not substitute for lifestyle. That should still continue, like being physically active, reducing sedentary lifestyle. And in fact, yesterday I was reading in some publication or in some news that some famous superstars and all, they ensure that they do not sit for more than 1 hour in one go. Right, it's very small thing that people can take care of, and regular breaks while working, doing some kind of physical activity, keep moving. So I think even and generally people try to take big steps, right? People want to go to gym, they want to run on treadmill and do long runs, but after that they simply sit at one place and do nothing, right? Dr. Saha, I have seen that you actively advocate prevention as a governance and sustainability issue. So if I have to see from a boardroom or policy lens, why should health be treated as a driver for organization resilience and long-term value creation?
See, when I speak about prevention, it is not a medical issue. It's
Okay,
actually a governance and sustainability issue. Because boardroom lens, health is not a cost center. It's a driver of organizational resilience and long-term value creation. And productivity and leadership continuity issue is a major factor in India. Because in India, the heart attacks are happening 10 to 15 years earlier. So many people in their 40s are affected with the heart attack.
okay,
So when this happens, that is not a retirement age compared to the Western population. It's actually the peak productivity age. So in such situation, not only the productivity will dip, it will fragment. The leadership continuity gets broken. The teams will lose momentum and strategic decision will get delayed. This will lead to recurrent absenteeism and some cognitive fatigue. There will be multiple medications which leads to side effect, and there is a long recovery arc.
okay,
So preventive healthcare should be important from leadership continuity issue also.
okay.
Organization plans for cyber risk, organization plans for succession risk and regulatory risk, but biological risk is often ignored.
Yeah, if I have to just stop you there in between. So I really like this statement that you mentioned, that organizations plan for all kind of risk, like cyber risk, or regulatory risk and all. But no one ever plans for a health risk. This is a very important statement you have made, and I believe that in today's environment, where we are seeing a lot of such cases increasing, where we have premature heart disease affecting the population in early ages of life, which is not actually retirement age, like you said. So this becomes a very important strategy for any organization to plan for health risk as well. So thank you for bringing this up, Doctor.
So, risk based thinking versus evidence-based healthcare. So when you control only events, the most organization get involved in insurance claim, emergency hospitalization, and medical leave sanction. But what is the hidden cardiometabolic risk accumulating? Who is likely to develop a heart disease in the next 5 to 10 years? Or what are the risks that are measurable even before such event appears? So when prevention is actually belongs to ESG, governance, and strategy. If ESG is about long-term value creation and stakeholders' responsibility, then health clearly belongs here. Health of the employee means sustained productivity, lower healthcare cost, reduce premature mortality that strengthens the family and community, and prevention aligns with the social responsibility, not just compliance. Ignoring preventable health disease while reporting ESG metrics just creates optical sustainability and not real sustainability.
Yeah.
Board should be asking, are we measuring the health risk that threaten long-term performance? Are our wellness program preventive or performative? Are we investing upstream or downstream cost is being paid by the board?
That is really a, good again statement you have made. Really a valuable statement. Like it's a downstream cost or upstream cost because generally, as you said, that organizations get stuck in those claim process only, right? When a person submits a claim, that's a, I should say, reactive uh, approach by organizations and individuals. And like your strategy of prevention, I really appreciate that. It's really a very good one. So organizations and individuals both should be looking into having that foresight rather into prevention rather than thinking about reactive reactions. So with that, I'll move to the next question, which is actually my last question for today. So if there is one medical, this one mindset shift that you want to give to the leaders, professionals, corporates in the country about prevention of heart disease and all, what would that would be basically the mindset shift?
Prevention is not a philanthropy, it's a strategic foresight. In India, we have got 11% prevalence of heart disease. That means 11 out of 100 is suffering from heart disease. And a recent study conducted by ICMR and All India Institute, published in just few months back, which shows that majority of the cardiac deaths, that is almost 57% of the cardiac deaths due to heart attack are below the age of 45. So that is very, very alarming. So it should be viewed, as an enterprise risk affecting any organization. So like in a factory, we don't wait for the fire to break out before installing fire smoke detector. Similarly, we don't wait for the data breach to happen to invest in cybersecurity. But in health, it is unfortunate that we wait for the heart attack before starts acting. The true prevention actually shifts the mindset from damage control to risk mitigation. And that is how mature leaders, resilient organization, and responsible system should operate. Prevention is governance in the most human form, anticipating risk before it becomes an irreversible loss.
So, Dr. Saha, thank you for such a grounded conversation. I really appreciate you coming to this platform and giving us such a enlightenment view of about heart disease prevention and all. And it's clear now that it's more about the heart disease is early recognition of risk in a person's body and not ignoring symptoms, monitoring many parameters like we talk about lipoprotein A and cholesterol and all, having good health, not falling into different kind of perceptions or different kind of false news narratives. Is always good to see your doctor and have regular checkups as prescribed by them. This is really really great, and I would say if prevention really truly powers progress, then this is a time when leaders should start acting before the alarm bells are ringing, right? So thank you again, Dr. Saha, for coming to this platform. I really appreciate it. And to my and you have been really sharing your perspective. I'm really so happy that to have you here. And to my viewers, like if you really want to look know more about this, I'll continue talking about how leaders and leadership, health, and decisions and people are going to intersect in future. Keep watching my future episodes. Till then, goodbye. Thanks, Dr. Saha.